patient has been booked in. We're going to do a root canal. So one of the things that we're going to show you too is on CADI. When your patient comes in for treatment, you're going to have CADI up on the computer. You're going to have their X-ray that was taken on the day that they came on the spec exam, right? So you've already been introduced to pulp vitality testing. And so you're going to have the notes from that pulp vitality testing up. You're going to have the X-ray done. And before any anesthetic is administered, there's going to be another vitality test. Just to make sure. And we're going to be giving a fair bit of freezing. You want a lot of freezing for a root canal because you're taking out the nerve, and you need pretty profound anesthesia. Okay? So we'll give our patient a rinse. Okay, and we're going to give that a few minutes. I'm going to be placing on the dam, and you're just doing a single hole, and then I'm going to put the clamp on afterwards. Okay, so you can notice the wings on this clamp, how big they are. You won't be able to stretch the dam over it if you put it on the tooth first, which is what you've been used to with regular restorative. So I'm going to put that on first, and then when you're placing this one, if you want to know which direction it goes, you notice how it goes straight down, and then the incisal edge sits right in that little trough there, okay? And I want to place the lingual first, down, and then seating it on the buccal, just like that, okay? So what that does is it isolates the tooth, and there we go. Okay, so Nina set things up earlier, and so we're going to start off with our high speed to gain our access into the tooth. So I'll need my HVE. Okay. Like that. Okay, so we're going to gain access into the tooth with a surgical length burr. This one keeps out a lot of water. You want to just put water on it? I'm just kind of seeing that. Okay. And we're just going to be making a small access to the lingual. So we're not doing restorative. We're going to go straight into almost the middle of the tooth by the cingulum. That's where the pulp chamber will be. So when you're working on mannequins, just be really conservative when making this access hole, okay? A little bit more. You're going to go down to where the access is. So I'm keeping her mirror clean. How are we doing there? Good?
I think that's about as much as it's going to go.
Yeah. Okay. All right. So we're getting close to the access there, and now she's going to go in with the slow speed burr. And sometimes when we're doing these access holes, you're opening up teeth that have a lot of decay in them, and you have to remove that decay to get into the pulp chamber. So there could be a lot of sludge coming out. Okay, so I'm going to give that a rinse. All right, so now they've removed some decay, and I'm going to give her, just to remove a little bit of decay, if there's any decay going into the pulp chamber. Okay, good. And then I'm going to have the Endo Explorer ready, because now she's going to start looking to locate the canal. Okay. Okay, so she's found the canal, so I'm going to give her a barbed brooch. So the barbed brooch is just like a piece of barbed wire. It is very, very sticky, and what it's going to do is going to enter the canal, and it's actually going to pull out that nerve, all right? Okay, so what I'm going to do now, she's putting the barbed brooch back. I'm going to give her the irrigation, and we're going to start irrigating this area. So the irrigation is bleach, sodium hypochlorite. Give that a good rinse. Good. Okay. So now what she's going to do, while I'm sorting out my files. I'm going to give her the 10 file, and she's going to start hand filing, okay? And when they're hand filing, they're just locating the canal, and they're locating the length of the canal. And as they're doing it, they're kind of sort of, you notice how she's kind of twisting a little bit? Okay, take that. Good. And then she's going to take a 15, and we're going to get an estimated work length. And what you can do is hook up this is a Root ZX, all right? So this is an electronic measurement to find out the length of the root, okay? So you're familiar with this lip clip, which is what you've seen with the pulp tester, and then we've got a file holder. This gets hooked on right above the stopper. And it's going to show the length of that root, okay? So once we get an estimated length, what we're going to do is we're going to write that down. And to get that estimated length, we'll take this off, take this out. My film, I would come here, take this, and I would come and go beep. So the patient is holding it because we can't remove the dental dam. And so that film, we can use a sensor and it'll pop right up on the screen. And I'm going to take a measurement, and that measurement is 17 millimeters. Okay, so that's my estimated working length. All right, so now we're going to slowly, and we have to prepare the canal for the root filling for that gutta perca. So with our endo ring, each of these represents a different size. The length is adjustable. All right, so I'm going to measure these to 17 millimeters and have them ready for the hand files, okay? And I'm going to go up to, say, a 25. And then she's just going to hand file a little bit. And in between each of those files, we're going to irrigate. So right now we're doing a mechanical debridement. And then the chemical debridement comes from the hypochlorite. Okay. So you want to be careful because this is bleach, all right? And this is where we get bleach stains on our clothes. So when I'm holding this, I have a gauze, and I'm just holding it like that. And as she's filing, I'm going through my files and making sure that there's a next file that's ready for her.
Half your job is reorganizing this because they're just going to kind of throw them all over the sponge. So I'm always kind of putting it back to where it's going to go because they're going to look for the 15 in the 15 spot, but they don't give it back to me like where it is, right? So you're always kind of working ahead and reconfirming every time I hand it back that I haven't pushed it past the 17, right? So if I have, you're going to readjust the little stopper. So always recheck them and then put them back in the file. So a lot of the job with endo is just organizing ahead.
So now we've done some hand filing. So we've opened up the canals. We've irrigated with our hypo. And now what we're going to do is we're going to move into our rotary. So each of these rotary files, they're going to look a little bit different. But just know that this is to open and shape the canal, all right? So everything that we do with our hand files and everything we do with our rotary files, it's to open, shape, and get down to length. So with each of these rotary files, you might notice some different ones on your sponges. Don't get too caught up with those details because, like I said, there's tons of different systems. All the different systems are going to look a little bit different. Some of them are going to have different colors. They're going to have different numbered bands on them. But just know that they're all different sizes. We can always adjust the length with that little rubber stopper. But each of these represent a different, let's say, width, okay? So we always start off with, say, a small, and just for sake of keeping it simple, we're going to go, say, like with our filing system, we have a 10, 15, 20, 25. In the rotary systems, it's kind of the same thing, okay? They have like they start off with like a 25, 30, 40, 45, because we want to open and shape that canal, all right? To accommodate our gutta perca. So our gutta perca, whatever the last rotary file that we use is going to be the same size as our gutta perca. Okay, so this is how we open and shape the canal to fit the gutta perca. Okay, does that make sense? Okay?
Yeah.
So they're going to use this just to finish opening and shaping, and they're going to do that mechanically rather than with a hand file. Okay,
Turn it off.
there.
And these ones will have like an auto stop if it's over torquing
Oh, there
with
we
their
go.
system. It'll stop so you don't break a file in there. The new ones are quite bendy. Some of the older ones are still a bit more rigid. And you're always going to have a dedicated handpiece for it. It can be wireless, it could be wired, but it's not going to be, even though they're both latch attachment, it's never going to be this one. Some offices, some doctors will put a couple drops of the sodium hypochlorite in there as a lubricant while they're going. Or we're going to use an RC prep, which is a bit of a paste. So you put that on a mixing pad and I would dip it and then use that in there for a bit of just so that way it's got that in and out flow. So this one, it turns on and stays on. Some of them you have to hold it on. And then I'm just going to put a little bit of RC prep on. And now instead of doing the hand files, we're going to go in and out.
And once she's done with that size, we're going to go up to the next size because we're widening and shaping, right? So when we're doing this, we're widening and shaping. And sometimes what I'll do is I'll take this out and I'll have the next one ready. I have it measured. This one doesn't have a stopper on it, but I'll measure it to 17 millimeters. Do that. I'll give her some RC prep. And going in. So now what she's going to do, she's done the rotary, we've chemically debrided, we've mechanically debrided. We're rechecking our size and our length.
Yeah.
So we're at, say, a number 25 at 17 millimeters. Okay.
So either we would put this in and do another x-ray with the file to confirm we're at the end, or some will do it with the gutta perca.
Yeah, do that.
So either we're going to do it with this point, or we might fill, leave the gutta perca longer, do it with that, just to make sure you got a good fill to the end. So operator preference is going to be depending on which one they do. Okay?
Okay, so now we're going to do a last bit of irrigation. Okay, we want to make sure that all that organic debris is out, gone. We don't want to be sealing up the tooth with any of that matter in there for possibility of reinfection. Okay, so once that's done, we're going to dry our canals. So I've got my paper points, and now I'm going to let her dry out some canals here. I'm going to have them ready. Take another one. Okay. And then with these paper points, they can actually see if the canal is still wet. All right. Sometimes they'll look at them and they'll put it up against their glove to make sure that it's, make sure that there's no exudate, there's no bleeding, that that canal is nice and dry before we put in our, thank you, before we put in our gutta perca.
So at this step, if it's not dry, we would rinse up, or we would mix up some calcium hydroxide. Either it's going to be a powder that you mix with anesthetic. Now most of them come preloaded in a little syringe. You just kind of squirt it in. Because if we can't get this dry, we're not going to put in the gutta perca. So if that was the case, then Lorna would be handing me, we would take the little lentil, she'd mix it up on the pad. We would take this little lentil spiral. I don't know if you guys can see that. All it is it's not cutting, it's just twisted. We scoop it on that, and when we spin it, it spins it down. So it like pushes it down into the canal. And then we would put a cotton roll on it, IRM it, and tell the patient that we're going to see them back just because we can't get it dry. Okay, so that's the step we would stop at if it's not dry right now. Okay, so some will always stop at that step. Some will, most of the time if we can get it dry, we'll continue on, we'll fill it because there's no point in revisiting it. But some of these abscesses have been like quiet, but there for a long time. So they're really hard to get everything drained out in one appointment.
Okay. So that is if we don't close it up. So we're closing it up right now. So I'm giving her a gutta perca just to double check the length. And like she said before, sometimes they'll place the gutta perca in, they'll do a confirmatory x-ray before we do a fill, okay?
That way we would confirm the length.
Okay, and
We're happy
then
with that.
now what I'm going to do is we're going to take that little Lenchulo spiral, oh I put it on already. I'm going to take that Lenchulo spiral.
So this one is our sealer. We're just going to dip it and we're going to spin it down.
So what that does, the Lenchulo, when it goes into the canal, it actually slaps that material onto the walls to help create a seal. Okay, good. We'll take that off. And then I'm going to have our gutta perca ready. It's all measured. And what I'm going to do is I'm just going to line it and give it to my operator. And they're going to place it at length. So this gutta perca is the same size as the last file that we did. Okay, so it's like a 25, the size 25 at 17 millimeters. So that's what I'm going to be putting in my notes. All right. So she's placed that. It's gone right to the apex. And then what we're going to do now, we're going to start backfilling. So we're going to give her a spreader, which is going to just create a little bit more room.
Manny's got wide teeth, so I could probably put 20 in here. We're just going to put in a couple. But normally that would fit almost perfect. So we'd be putting this in just to see if there's any room for another one, and there is. So then I'm just going to backfill.
Do one more. There. Okay, and we only have to put the sealer on just for that first master cone because it's fit right to the apex. So at this point, now that we've backfilled, we're going to cut that off. Now there's an instrument, you've probably seen them in each operatory. This is a little heating instrument. And so when you press this button and it goes red, this gets very hot. So what I normally do is I have a wet gauze and I'll heat it up. Now one of the things is when this heats up, there's smoke that comes from it. And don't forget, your patient's nose and eyes are right there. If they see smoke coming up from their mouth, some of them get a little bit alarmed. So what we've done is we've cut those off. Now I'm going to give her a condenser, or like a little plugger, and she's just going to plug in that hot gutta perca into that space. So we plugged it. Now that area is sealed off. Are you happy with that, doctor?
Yes.
Okay. So now that the root canal is technically finished, we are going to either take an x-ray before we put our filling in, or we can put a temporary filling in with this cavit, and you can scoop it out with a spatula. Okay, roll it up into a ball, and they can place it in like that. Or
sometimes they'll put a cotton pellet in
yes,
if they want to
yeah.
get access.
Right. So yeah, like Nina was saying, sometimes we put a cotton pellet in there just so when we open it up again, we know where the access is. Okay, so go, and then we can put our cavit in, but what we're going to get you guys to do today is bring out the IRM, and we're going to get you to mix some IRM. Okay, so we'll mix that up and use that as our filling, our temporary filling.
So if we had stopped at the other step, we would definitely be putting in IRM because it's got those medicinal properties to help soothe the tooth, okay? When we're completely done the root canal, either they're going to do IRM, especially if you're leaving a specialty office, they're going to send them back over so you can do the definitive restorative procedure. In your general practice, generally right now, we're going to take out our etch, prime, and bond, and we're going to fill this in with like a permanent filling. Something patients need to know is that the IRM or the cavit they're going to wash away with their saliva. They've got about a week or two to kind of make sure that they get back to us to do it.
There. So she's going to take a little bit of that lovely IRM.
It's mixed.
And it's mixed to perfection. Okay, so that's our filling, our temporary filling. I'm going to give you a wet cotton pellet to help it set up a little bit faster and smooth it off. Okay. This is where I'm going to take up all this shrapnel there, and then we're going to take the dam off.
Yeah.
Okay. Okay, so we'll take this off and give our patient a rinse because they've been under a dam for a little while. All right. So we've taken the dam off. I've given my patient a rinse. We're going to check their bite. And it's going to be perfect because Nina did an amazing job. Okay.
No marks. Yay.
No marks. And then what I'm going to do is I'm going to take a final x-ray. Okay. So I'm going to put that there, take my x-ray. It's going to pop up on the screen. And what that is, that's just a confirmatory x-ray that gutta-perca reached right to the very end. And we can see that little poof of sealer material. And now I'm going to go through, post-op, okay? So I tell the patient that we've just finished the root canal on this front tooth. And things are going to feel tender for a little while. So you will not feel hot and cold sensitivity because the nerve is now gone. The tooth might be a little bit tender to bite on because what we've done is we've actually irritated the inside a little bit, okay? So they might feel like the tooth is, you're going to have a worked on feeling. That's what I tell my patients. Something that either Tylenol, generally Advil works a little bit better because it's an anti-inflammatory. And so don't bite on anything hard. Wait until the freezing comes out before you have anything hot or cold. Same thing as with restorative. So that's like your anesthetic post-op, right? You don't want to bite your lip or bite your tongue, depending on where that procedure was done. And notify the patient that that tooth will need a root or will need a crown at some point. Whenever we do root canals, the root canal tends to make the tooth brittle, especially with molars. So we recommend having a crown placed on that in about 6 months or so. We want to make sure that the tooth is settled down. Yeah, just that worked on feeling, and over-the-counter medication should help it, but it will not have hot-cold sensitivity, all right? And if there's any questions, call the office. And always make your notes, okay? In your notes, recommend it to the patient needs a crown.
Writing
Even what we do.
where you're obturated to, what type of files you used, what was your last size. Like, they're reporting a lot of that. All the irrigation solutions, RC prep, sodium hypochlorite.
We do have the charting on like a template here, but like Nina said, everything that was used in the mouth has to be noted, all right?
Okay.
So we do have a template for the charting, and come and check out the template. We'll leave it here in Op 1, and you can do your charting on Dentrix. So like restorative, you'll probably spend the first few minutes just setting up your tray and understanding sort of the sequence of those events. And like Kathy said too, in the binder, there is a sequence of how to do things. Okay, so you can follow those sequences.
Pull up binder. It's going to be the little, the endo tray has the gray color in it, not the red. Okay, that holds our instruments. And then you'll have a little endo bin that's got all your extra stuff in it. Yeah, okay, because in office this will be like huge. We'll have like extra of everything. But for here, we've got a little endo bin that you're going to pull out, and then you've got a tray that you're going to set up. They should all have IRM in there. You'll have CAVIT. Use both. Like, take a look at both so you see it. But go back to practicing your mix, because we will probably have you integrate that into your valve. And you'll do it like chairside during the procedure with us.
Yeah.
His teeth, you're just going to go in really shallow because they bottom out into the screws. Okay, so they don't have true canals. We're just doing it for the simulation of going through the steps. So
Yeah.
most of your files are going to be 5 in length.
Yeah.
But think about where you'll do an x-ray, like where you'd stop and do an x-ray and stop and do certain checks, okay? And we'll come around and help you.